2-minute warning. We're going to start very shortly. If everyone wants to grab a coffee or a bottle of water, we'll get going in just a quick moment. So perhaps with that said, I'd like to welcome everybody to today's webinar on how to safely reopen and continue reopening your establishment. I'm going to start first, though, with a land acknowledgement statement, respectfully acknowledging that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga Chippewa First Nations, collectively known as the Williams Treaty First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina First Nation Islands. Peterborough Public Health respectfully acknowledges that the Williams Treaties are First Nations, and they are the stewards and caretakers of these lands and waters in perpetuity, and they will continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. So with that said, and without further ado, perhaps we'll get started. Thank you for joining us so early this morning. I trust everyone can see my screen, and we have you muted for the time being. But please, if you do have any questions, we're going to be moderating the chat feature on the side. If you wiggle your mouse a little bit, you'll see some menu options come up, and there's a chat function there, and we have staff on hand that will be moderating that chat and making sure that your questions can get answered. On the line with us today, we have Julie Ingram, who's our Manager of Environmental Health. Janet Dawson, myself, and Claire are health promoters with Peterborough Public Health, and Nimrod is one of our public health inspectors. Joining us from the city is Brian Buchard as well, who will be offering some tips and tricks and things like that. So the first piece here is a little bit of disclosure. We are recording this event, so that those that are, sorry about that, a recording of this webinar will be posted after the event, so if you have missed it, you'll be able to see it online afterwards. We know that throughout COVID-19, things have been very, very, very fluid. So as of this morning, July 10th at 8 a.m., this is the most current information that we do have. But we are committed to making sure that you do stay up to date with the information as it comes out. That said, if you have your own channels and are able to figure out what's happening in your specific sectors, we welcome you to start digging there as well and knowing what those responsibilities are. It's not legal advice. It's based on the best available knowledge and information to date, and it's really designed to help you make informed decisions about your establishments. Likewise, the city of Peterborough is on this call, which is fabulous, but if there are some establishments in the county, you would need to check with your municipality for those guidance documents as well and find out what's permitted in those municipalities. And likewise, PPH, Peterborough Public Health, has the geographic region of the city of Peterborough, the county of Peterborough, and the 2 First Nations. For those joining us outside of our catchment area, we would encourage you to as well check with your local public health unit for advice. So with this said, the information session is going to really focus on showing you what guidance documents are available to support and let you know where they're located. There's lots of resources out there. We're going to learn about the controls that you can put in place to protect yourself, your staff, your employees, the people that come into your establishment, and talk about the different tools that are available in helping those folks. We've also developed a workplace toolkit, which we sent out last night, that will hopefully be able to walk you through kind of a step-by-step process as well. We have some information about masks, which is a hot topic right now. So we'll be sharing that with you towards the end of the slideshow. The toolkit, the provincial workplace website, which is kind of our go-to for all of this information, and then most excitedly having a chance to open it up to field questions to both city staff and Peterborough Public Health staff. So just a quick little snapshot. The most recent one is that obviously about 115 days ago or so, on March 17th, they enacted the emergency order, which governs everything that's happening throughout the province right now throughout this pandemic. And underneath the state of emergency, they have a variety of emergency orders, and those are the ones that we've come to know and understand to keep us safe in terms of number of people in stores, number of people you can hang out with, places that you can go and play, and all of those types of things. So there's the state of emergency, and then under that state of emergency, we have the emergency orders, and those emergency orders have been recently extended until July 22nd. Right now, just as a bit of a recap as well, we are in stage 2 of phase 2, and some of the most important notes from that one are that social circles now, you can have up to 10 people for backyard barbecues and small get-togethers, provided that you're staying that 2 meters apart. The social gatherings, sorry, that was the social gatherings rather. The social circles are where you can hug and high five and do those types of activities with a committed group of 10, and visits to long-term care homes under some strict parameters. So all of these things are fluid. New things seem to get added each day, but that's kind of where we're at along the way. We know that stage 3 is coming. We're not sure when it's coming. The province and the ministry that are guiding these decisions are really basically looking at the data, the trends, the number of cases, and those types of things, and that's what's informing moving from stage to stage. And the one thing that we might add is that even when we do hit stage 3, it's not going to be a free-for-all. It doesn't mean that everything is wide open the way that it was in 2019 or 2018. There will still be all of the public health measures that we've come to know and appreciate and respect in place. It'll just permit some other buildings and offices and organizations to open. And then phase 3 is that longer term piece. So right now, stage 2, phase 2, stage 3 is on the horizon. We're not sure when, and that will lead us into phase 3, that recovery phase. So we're in phase 2, stage 2. Why are we talking about toolkits and masks now? And the big piece with that is that dealing with this pandemic is not a sprint, it's an absolute marathon. And we want to now redouble our efforts. The numbers are exceptionally good in Peterborough. Provincially, the numbers are coming down as well. There are lots of good news stories everywhere we look. But in past public health experience, we know that as soon as we take our foot off the gas, that's when things start bubbling up to the surface again. So in terms of toolkits and retail and shopping and customers and clients and staff, the big piece right now, or the big message is that yes, things are good, and we now need to make sure that things stay good. We know, working with the Peterborough Chamber and the Kawartha Chamber and Economic Development, that Peterborough is a tourist hub, and we're going to have lots of visitors coming to our area over the next few months. So we really want to make sure that we're doing absolutely everything we can to keep those numbers as low and manageable as we can. And that's where we'll land in phase 3. The ministry is still recommending that as many people as they can work from home, that telecommuting that we're doing as we speak, those types of things like that. And like I said earlier, phase 3 will largely mean that a lot of other businesses can open. However, hand hygiene, physical distancing, respiratory etiquette, group sizes, those types of things will still be in place. So we just want to stress as well that as exciting as it will be to move into phase 3, it still means that we need to be vigilant in our efforts. So with all of that said, we're going to direct you now to the Workplace Toolkit. We sent you the link yesterday as part of some pre-reading if you were so inclined. And again, these slides will be shared and the presentation will be shared with you afterwards with all of the resources as well. But if you go to the Peterborough Public Health website, we have a section specifically for workplaces and retail. And there's an orange button, as you can see, with the Workplace Toolkit. So I'm going to turn it over to Claire, who is our health promoter working on this, and if I did this right, we will be able to walk through Claire. Claire, are you there?
Yeah, can you hear me?
Terrific.
Perfect, thanks Keith. So I'll let you load that up, but the toolkit is based on the Ministry of Health's guidance for essential workplaces, which is also available on our website. It includes several checklists to help non-healthcare workplaces and businesses reestablish operations in a way that reduces the risk of transmission of COVID-19. So throughout the toolkit, you'll see links to online resources and signage provided all throughout the document. Completion of the checklist is not mandated. However, workplaces and businesses are strongly encouraged to consider the information provided as they reopen their doors. So if you click on it, Keith, is it loading?
It should be up. So I believe that I'm sharing my screen, so people should be able to see it. Janet, can you just text if you can see the workplace on my screen?
Yes, I see the screenshot. That's what I'm seeing, but that's okay. If people have it, they can click on it. I'll just continue to walk through it, and hopefully we can get this figured out, but that's okay. So the first section provides an overview of the general infection prevention and control measures that are recommended. So as Keith mentioned, physical distancing, hand washing and hand sanitizing, the use of non-medical masks or face coverings, respiratory etiquette, and work from home policies. We then get into the section you see on your screen now that is about the hierarchy of infection control pyramid. And this can be used to determine the effective strategies to reduce the risk of COVID-19 in your workplace. And if you aren't familiar with the inverted triangle, the link is also provided in the toolkit. But in essence, if you picture an inverted triangle, the top tiers are generally considered the most effective at minimizing risk or exposure to COVID-19. They're better than the lower tiers. So often you need a combination of several of these strategies to effectively reduce risk. So the very top we have, which is the most effective, we have elimination, which is the removal of as much risk as possible. So if, for example, businesses turn to curbside pickups and delivery during stage 1, so removing the in-person contact. You then have engineering controls that deal with the design or modifying of the physical space. So you're seeing this in installing plexiglass barriers between employees and customers, improving ventilation, and installing hand washing stations. Further down the pyramid, then you have administrative controls. And these deal with the way actually altering the way the work is done through policies and work practices, such as employee training on infection control, permitting work from home policies and flexible work hours, and enhanced environmental cleaning. And then at the very bottom, or the tip of the triangle, you have the personal protective equipment. And this refers to things such as the use of masks and face shields by employees, clients, and customers. You'll now see on page 4, if you keep scrolling, Keith, we get into a series of checklists. And the goal of these is to make it as easy as possible for you to consider all the ways and all the public health measures and controls that you can implement to keep your employees and patrons safe. So the first one we have is screening, which includes having appropriate signage about symptoms clearly posted at the entrances of your establishments. You'll see links to the self-assessment tool and links to our local self-assessment centers for testing. And then the next checklist is about physical distancing measures, which goes through things such as floor spacing markings, directional arrows, the use of plexiglass barriers, modified store hours, staggering breaks and lunch times for your employees so that the lunchrooms aren't crowded, and it goes through several of those things. I should have mentioned, sorry, at the beginning, that on the one side, the left-hand side of the checklist are the action items, and then you'll find all the notes and resources and links out on the right column. The next checklist is about mask and personal protective equipment. So we're strongly encouraging workplaces to develop a workplace masking policy for employees who enter the establishment, employees and visitors, and customers. It is very important that you as an employer provide proper training to staff on the policy and the use of personal protective equipment. At this point in time, Peterborough is taking a voluntary masking stance and relying on each business to implement their own masking policy. Any customer, patron, employee, or visitor who enters a commercial establishment in the Peterborough region is advised to wear a face covering while inside an establishment. And at the end of the toolkit, you'll see a sample masking policy has been included for you to adapt. And later on in this webinar, Janet will be discussing the use of non-medical masks in greater detail. Sorry, Keith, I jumped there for you, but the next two, there's the sample policy that you can see on your screen. The next two checklists after the masking one are about hand hygiene and respiratory etiquette. So there's signage there available that can be posted in all public and staff washrooms and lunchrooms and shared spaces with the proper steps to hand washing, hand sanitizing, and covering your cough and sneezes. And then we get into enhanced cleaning of public settings checklist. This is another control method to reduce the spread of COVID-19. All high-touch surfaces are cleaned and disinfected at least twice a day, including doorknobs, elevator buttons, countertops, touchscreen surfaces, keypads, credit cards, and debit machines. Anything that there would be high-point touch should be cleaned regularly. And then scrolling down, there's a checklist for employees who need to enter the homes of clients. And then there's also the last one is about a checklist for the policies and procedures that you would need to implement to make all these happen. ensuring things such as a policy is in place to ensure employees stay at home if they are ill, that they are aware of COVID symptoms and where to seek testing, that they're able to find relevant COVID information, and all those procedural type things are all there for you to consider as you develop your controls. And lastly, as I mentioned, there's the masking policy at the bottom that you can adapt. And this is for indoor non-healthcare public settings. The sample policy provides links to signage and other resources, such as how to properly wear a mask. And it also lists those who may be exempt from the policy. So you can take a look there. So that's the policy really quickly, went through it. In essence, the toolkit, I started the policy, the toolkit really quickly. The toolkit provides you with the tools and resources needed to help develop and implement policies and protocols to keep your employees, visitors, customers, patrons as safe as possible and to reduce the risk of the transmission of COVID-19.
Terrific. Thanks, Claire.
And this is, as Keith mentioned, everything is very fluid at the moment in public health. So this is going to be living on our website. And as we get more information or as we get more resources, we will be updating it. So I do encourage you to come back and check it quite frequently. So if we go to the next slide, Keith.
Do we see that?
Okay, we're at the beginning of the slide, but that's okay. The slide deck.
We'll get there.
We'll get there. I'm pretty sure the next slide was just a summary of everything that was included in the toolkit. So talking about the physical measures and all the infection control things that you can do to reduce the spread of COVID-19.
Welcome to learning on the fly.
Oh, we went
spoiler alert.
There we go. Yeah, so it just gives you and we really are encouraging businesses to take a look at this, use the resources necessary. We're trying to make it as simple and as easy as possible for you to do this and be able to open your doors safely so that your customers feel safe coming in and your employees feel safe and you have all the adequate controls in place. And then the next slide shows, I wanted to give you a reference of some of the images and the signage that we have available for you. So these are all linked out in the toolkit, plus they're available on the signage page on our Peterborough Public Health website. So feel free to use these resources. We've created them for you to make it very easy, post them, so everything's very clear for the public. Okay, so I will now pass it back to Keith to walk you through the provincial workplace website.
Terrific. And this is where, by and large, we're pulling all of our information from. So if I'll just switch screens and I'll share this one, I believe. How do we feel about that? Can everybody see my workplace screen now? I'll take that as a yes. So on the workplace website, this is primarily where all of our guidance documents live. This is where all of the tools were pulled from for the toolkit that Claire was just discussing. By and large, all of the most popular ones are pulled out in these tabs here: the retail sector, food and restaurant, obviously. And each one has a guidance note, which is kind of a paint by numbers approach as to what you need to do to make sure that your place is as safe as it can be. But there's also a variety of posters and things that you can put, general FAQ questions, those types of things, again, for more specific ones. The one where we spend a lot of time, though, if you scroll all the way down to the bottom, there's 100 and some odd, 179, I think the last time we counted, guidance documents for very specific sectors. And the reason that this was done is because the retail sector, as an example, is a very dynamic sector. And whether you're looking at a store on George Street or you're looking at a big box store on Lansdowne, the guidance documents kind of speak to all of those different scenarios that you might encounter. So you might have to do a little picking and choosing to find out which pieces are most relevant to your space. But by and large, all of the guidance documents that you could ever have questions about are here. So we just wanted to direct you to the ministry's website as well, which has informed much of the creation of that toolkit. So with that said, I think we'll move back to non-medical masks. And I'd like to introduce Janet Dawson, who is going to be our health promoter speaking to this topic.
Good morning, everybody. Thank you so much for joining us so early. We wanted to offer this webinar at an early time before you would be opening your establishments, so we really appreciate you joining us this early. So we wanted to spend a moment to talk about non-medical masks and face coverings, because there is a lot of conversation about this in the media presently. We are seeing the adoption of mandatory mask regulations across the province. We do not have a mandatory mask regulation at present time in Peterborough County and City. There are some jurisdictions close to us that do have mandatory mask regulations, so I can understand that it might be a bit confusing. So we thought we would take this opportunity to highlight some of the options that are available to you for your establishment. So and we also thought it would be good to explain a little bit of the science behind the non-medical mask and face covering. So I will refer to it as masks moving forward, but it is around the non-medical side. So they are considered a source protection. And what we mean by source protection is actually they are reducing the amount of respiratory droplets coming from somebody's mouth and how many that would be emitted into the environment or onto surfaces. So they protect from the source of the respiratory droplet. There is growing evidence that COVID-19 can be spread by people who are asymptomatic or pre-symptomatic. So those are the asymptomatic, they do not experience symptoms or are not feeling symptoms, and the pre-symptomatic are the days right before symptoms would emerge. So the idea behind non-medical masks and face coverings would be to protect the respiratory droplets being emitted from somebody that may not even be aware that they are infected. So it's an interesting time because we are assessing evidence and doing evaluation in the middle of a pandemic. So the information I'm presenting to you is the evidence that we've been able to pull as of 8 a.m. this morning, but there is new evidence emerging and being evaluated every day. But we are looking at modeling studies to tell us what if we did have a high compliance rate of non-medical mask use, what would that do to reduce the spread of COVID-19? And one study is estimating that 50% compliance of the use of masks in public settings is not sufficient to prevent the spread. But the modeling data would show that 80% compliance would reduce the spread. So we do need to have quite a significant number of wearing masks in the community to reduce the spread. However, we also can see that if you had a number of people in your establishment, increase the number of people in your establishment wearing masks, then it would also support making that area safer. Next slide, please. Now, there are some real benefits to wearing a mask, and so I thought I would show you a bit of the benefits, but there are also some challenges as well. So as we mentioned with the modeling data, that we know that it may be beneficial to prevent the transmission of COVID-19, wearing a mask. But one of the more important, I think, aspects of wearing a mask is the visual cue that it provides when you see somebody wearing a mask. We are still in the middle of a pandemic. Even though we are in reopening stages, we still have the public health measures that we have to employ. Everybody has to, and all establishments, in order to keep the spread and transmission down. So having a visual cue on your face definitely shows that we are taking measures to reduce the spread. Also, if the benefit of wearing a mask is if there is a barrier in front of your nose and your mouth, you will reduce the distance the droplets would come out of your mouth. So that there is definitely some science behind that, but we know that the mask does not protect the wearer. This is different than medical masks. Medical masks are designed very differently, but non-medical masks or face coverings are not designed to protect the wearer. It's designed for the benefit of others. So if you were to require masks in your establishment, it is to protect other people. So if staff were to wear their mask, it's to protect your customers. If your customers are to wear the masks, it's to protect your staff. So it's mutually beneficial. The other thing is, this can go both ways, but if you have a covering over your mouth and nose, it can prevent the touching of the mouth and nose if the hands are washed and the mask is used correctly. And that last part is very important. If the mask is used correctly, I'll highlight that in the challenges. Next slide, please. So there are definite challenges to wearing a mask. Not everybody may be able to wear a mask due to health reasons or other accommodation needs. So, and it's not easy to tell. We can't see somebody walking down the street without a mask and understand the reasons behind that. So there can be, you know, mandatory mask or requiring masks can be very stigmatizing. There is discomfort with prolonged use. So there is the need to make sure that you are giving a break from wearing your mask to be able to give your skin a time to breathe. Masks can also provide a false sense of security. Because we do need to make sure masks are worn as an added layer of prevention. Masks do not replace physical distancing, nor do they replace good hand hygiene, or do they replace staying home when you're sick. Masks are just an added layer of protection on top of the other public health measures. Now, donning and doffing a mask is really just taking it on and off properly, and it has to be done properly. So to do that, and we've provided these training resources for you for your staff, you do need to clean your hands and put the mask on. And if you're taking it off, clean your hands, take the mask off, put it away, and then clean your hands again. So there's 3 points in time where you have to clean your hands if you're going to put on and take off a mask. So that does have to be done properly, and carrying and storing a used mask may create a higher risk. And I'm sure we've all been in stores where we've seen people take them off like very quickly and just store them right in their handbag or purse. And that isn't a proper way to store your mask. Masks vary in quality, and that's definitely true because face coverings can be made with any bits of material. So there's definitely isn't a rigorous quality behind the masks because we can make them from anything we can just to provide some sort of protection over our mouth and nose. The other challenge to masks, as I mentioned earlier with the donning and doffing, if we were to require it in our establishments, that does require having hand sanitizer at entry and exits to support people who are putting them on right before they enter an establishment. And of course, it's an equity issue. Some members of the public may not have or own a mask, and that could inadvertently mean that they are excluded from accessing services. Next slide. But I did want to highlight for you that the public support for masking is growing. There is public support for policies and regulations to be in place for mandatory masking. So seeing establishments with notices posted that a mask is required in those establishments, there is support growing for this. So this is the results of a Statistics Canada study titled Precautions that Canadians will take or continue to take as COVID-19 safety measures are relaxed. And so I thought it was important to show what is emerging. We are definitely seeing a higher percentage of women and new Canadians with a higher percentage of support for masking, but they're also quite above 50% for men and a Canadian born. We are seeing that definitely seniors or older adults are very supportive of masking, and in particular in urban settings where there's a higher population density. Next slide. I think this is a really important slide. This is an analysis of the precautions taken as safety measures are relaxed. So this is what people feel they will do and are important, and 65%. So we're almost at 3/4 where wearing a mask in public places where physical distancing is difficult is supported. So we're getting closer to that 80%. So I think that's important as we're thinking about helping establishments set up safely, that there is a growing support for having policies in your establishment for masking in that space. Next slide. And this is, I think, just looking at the provinces a little bit, we shared a few here. Ontario does have the highest support for wearing a mask in public. And so you'll see there, it's the green bar at 78%. So there is quite a high support. That's just a general summary of the support for Ontario. So I think that this is a good time to think about your establishment and whether you would like to require the use of masks. It's definitely within your scope to require the use of masks for staffs and or patrons. And so we have prepared in the toolkit a sample policy for you to use and adopt. And it's important that the policy, and you can modify the sample policy that we've provided or look at it for ideas, but it is important to define the scope of the policy. So the scope will say is really what you will be doing as an establishment. And we've provided some examples there for you, which is develop a policy and stipulate it's for patrons and staff, that you will provide a copy of the policy to any person who would like to see it, or you'll post it. That's always I think a good option. That you will have signage at the entrance and exits to make sure that people are aware that your establishment has a requirement for a mask, and that you provide the hand sanitizer at the entrance and exits as well to also foster that proper donning and doffing of the masks. You will also have to train your staff to deal with the questions that will arise. And I know many people are concerned about turning business away. You don't want to turn business away. We've just gone through a shutdown period. It's not time to turn business away. So if there is an opportunity to have a small quantity of masks on site for anybody who would like to access your service and they're unable to have one, then you are able to provide it. That is a great option. And I know in Peterborough, we are actively seeking, looking for various supplies of non-medical masks. So we can share that with you as we learn, but there is the provincial registry of PPE, and we'll send that out with the slides at the end of the webinar. And in the provincial registry for PPE, it makes you think it's only a registry for medical masks, but you can actually go in the drop-down menu and click that you're looking for non-medical sources of masks, and up will come all the suppliers for the non-medical sources. So there is a nice registry available, and we'll send that link out after the webinar. Next slide. Great. So I'm now going to turn it over to Brian Bouchard. Brian is the urban design planner at the City of Peterborough. And I recognize that we have lots of people on the call today that may not be from within the City of Peterborough. However, we thought it might be useful to hear the process that the city has put in place. If you have an establishment and you would like to expand into the outdoor area, and that expansion would be on public property. So Brian is going to detail for you the process to apply to expand on public property, and then it'll come back to me to talk a little bit about setting up your outdoor retail space safely.
Thank you, Janet. Are you able to unshare your screen there, Keith?
You bet.
Thank you very much. One moment, please, ladies and gentlemen. Can everybody see that?
We can see it, Brian.
Thank you. Yeah, so as part of reopening businesses safely, and this is with respect mostly to the downtown, because that's where we have the highest density of businesses. As you can picture, consistent stretches of buildings with unit after unit of commercial establishments. The city has implemented a downtown public space plan, and that was put in place really to put in place for physical distancing, to allow restaurants and bars to open and expand out into the public space onto the sidewalk. In many instances, such as George Street, the parking space zone has been converted into a pedestrian lane to allow businesses to expand into the sidewalk space, and in some instances, even further out into what is normally the parking space zone. And the city has in place now a set of steps for the approvals for the establishment of patios within the public space, and we're extending that further to all commercial businesses that want to make use of some public space, and that's the focus of this discussion now. Incidentally, the city has issued 23 permits, patio permits in the downtown, 6 for expansions and 17 new on George Street, Charlotte Street, and a section of Water Street and Hunter Street. So in this diagram you see before you, this is an illustrative guideline for the location of display tables not requiring city approval. And we've deemed it would be fine for establishments to display some of their merchandise or what have you right up against the building to a maximum distance of 0.6 meters or 2 feet from the building's face. And that would still allow for pedestrians to pass safely back and forth on the sidewalk. Even if somebody were to stop and view some of those display tables, there wouldn't be an issue. There's no permit required for this and no certificate of insurance required for this. One moment, please. On the next slide, you'll see a more aggressive use of the sidewalk space. And in the downtown, we typically have adjacent to the curb approximately a 0.6 meter or 2 foot amenity zone, we call it. And that's a zone for garbage receptacles, street lights, bike racks, that kind of thing. And if you're able to see my cursor, that's usually where it is. And we're saying to businesses, if they want to expand onto the sidewalk, they may do so up to where the outer limit would be to the amenity zone. So that may be about 10 feet of sidewalk from the building face. So this illustrative guideline shows that across the building face, you may have merchandise or what have you split to either side of a building entrance. Many of the building entrances in the downtown, being heritage buildings, have it centered within the commercial space. So this illustrates how you may display your merchandise relative to the building entrance as people may be lining up or coming back and forth through that building entrance to provide physical distancing from the area or zone reserved for the merchandise. The next slide shows a little bit of a different scenario where the building entrance may be located laterally and there may be a broad area in which to display merchandise. Again, up into that curbside amenity zone from the building face, strictly across on the sidewalk across from the business establishment's building frontage. If it were to expand further beyond the business establishment's frontage, approval would be required from the abutting property owner or business. So for anything that spreads beyond the minimum 0.6 meter allowance adjacent to the building, a permit would be required, identical to the process we have in place for patio permits. And as well, we would require a certificate of insurance to $2 million liability to permit that to happen. I may also note that access ramps would probably be preferred by the business. It's something that is not part of the city approval, but it's something that would be permissible to allow at least some facsimile of barrier-free access to the business establishment. Thank you.
Great. Thank you, Brian.
I'll unshare my screen.
Now we'll head back to Janet. And I'll do this. Great. Janet, you should be seeing it now.
I do. Thank you so much. So that's great news that there's, whether you are on private property and have approval for the private property owner to expand your retail space, or your only option is to expand in the public space, it's great to see that there's a process to do that. And there's an opportunity to enhance your retail environment. So, and just to highlight from a public health point of view, the risk of spreading COVID-19 appears to be higher in indoor settings. So it is really great from a safety point of view if you are thinking about expanding your retail space into the outdoor setting. Outdoors can be less crowded and there's better air circulation. And if the way your system's set up, your outdoor setting can have less surfaces, which is of course has the potential to be less contaminated. So it's really exciting to see the outdoor retail opportunity take shape. Next slide. I'm not seeing it come up. I'm just not sure if it's a lag on my end.
This
there
one's
we go.
Oh, there we go.
Wonderful. So the setting up your outdoor space is the same as setting up your indoor space. So we didn't come up with a separate resource for you to follow for the outdoor space. It is the same setup. You follow the same criteria in the toolkit. You have to still ensure the 2-meter physical distance from staff and patrons. So depending on whether you're going to use that outdoor space if you're setting up any clothing racks or tables of books, you'll want to highlight in some way the expansion zone that you are using, particularly if you're in the downtown core and it's a little uncertain of where you are with the pedestrian zone. You will want to delineate your space, and you will be, and you can post signage to ensure how many people are allowed in that zone at any given time. So you will want to consider the 2 meters apart for some of those display items, and potentially depending on if you have books, tables of books or clothing racks or bookshelves, there may only be one opportunity for one person to be in between the space, but you can use the toolkit to measure out the space to put that together safely. There is still the opportunity. I know there's concern about the number of items that may be touched in an outdoor space. So you can still have hand sanitizer available and post signage, or have staff do some reminders about sanitizing hands when items have been touched. Signage, of course, it's the same signage that would be available in the toolkit. So if you are going to have a retail table, an outdoor curbside pickup table, or an area where they would be cashing in and out, you can use a physical barrier that would mount on the side of the table for the staff that would be standing behind there. The other thing is they can use the non-medical masks as well, especially if you are going with a workplace policy. Now, the non-medical masks are not necessarily recommended in an outdoor setting because you're outdoors and there's good ventilation, but of course you would want to implement that if there was any point in time in that outdoor retail space where 2 meters physical distancing would be a challenge. And we do recommend that you have your washrooms available. Washrooms can be available for your patrons at this time. You just want to make sure that you're doing the cleaning and disinfecting twice a day or when visibly soiled. I've linked here when you receive the presentation at the end after the webinar today. This link here will take you to the guidance document for the public space cleaning, and we also have it in the resource list at the end of the presentation. So I encourage you, I know that I think it's very exciting that there's that small zone that you're able to expand into without the permit in the city of Peterborough, and the option to expand broadly following the application process with the city is great. And I know that many will want to think creatively about how you can use that space. Just remember that I know we've received questions around whether that could be a space used for a bit of a teaching classroom, depending on the type of retail that you're offering. And just remember that you have to maintain the activity within the current emergency orders. So at presently, that would mean no public gatherings, but you can use that space as a private event space, but it would need to be to a maximum of 10 people. We are not allowing any gatherings over 10 people, and anybody who is not from the same household or same social circle at present would still need to maintain 2 meters apart. So you get creative with that space, absolutely, and just make sure that you're maintaining within the current emergency orders. Next slide. There we have it.
Great. So this is the exciting part of the conversation, and thank you, Janet and Brian, for all of the information. It certainly makes it a lot easier, I think, to navigate knowing what the black and white of the pandemic is. So without further ado, I'm going to turn it over to Julie and Claire, who will be moderating the chat, to read that out. So I believe there's a few questions in there already to get us started. And again, if you do have any other questions, by all means, please put those in the chat and we'll share those with the group. Julie and Claire?
Great, thanks, Keith. We did have one at the very beginning asking, are face shields comparably effective to masking? And the response to that was that face shields are more of a form of eye protection, a substitute for safety glasses or goggles. They do not reduce the emission or spread of droplets from the wearer's mouth or nose, so do not have the same efficacy as masks as the main source of control. We also had another question about whether or not we would be posting this webinar and the slides online. And yes, by the end of the day, we will have the live recording posted on our website as well as on our YouTube channel. So you can get that. And the last question that was posted was around why did Peterborough Public Health not make mask wearing mandatory? And I'll leave that one to Janet to discuss.
Yeah, that's a great question. Thank you so much. We're actually in active conversations. It is something that we're monitoring the situation very closely. It is dependent on numerous factors in order to create a heavy piece of regulation like that for a region. So there are 34 health units in the province of Ontario. We're actively monitoring what each one is doing. 17 as of yesterday had put in a mandatory mask regulation. However, that decision is dependent on many factors, including population density, current case rates, the method of transmission, whether there's a high number of community transmission cases. So it is quite a decision to make. So at present time, we are still going with a strongly recommended voluntary approach. We are in active conversations with our local municipalities and First Nations in regards to what the data is showing and what the trends are for our area. So at that time, that's why at present we are recommending that you, the establishment and the business owner, can create these policies, particularly to try to increase compliance within your space. As you get to the 80% in your space, that you will be creating that safer environment in your establishment. And I can say that we will make announcements if that will change in Peterborough, but at present time, we are remaining with a strongly recommended voluntary approach.
Great, thank you, Janet. There's a question about where's the best place to find HVAC system requirements, and we suggest that you talk to the building officials in your local municipality for that one. There is another question about, are there particular precautions we can take to protect high-risk household members? And I'm assuming that's, I mean, there's things in place like having separate shopping hours, so having, for example, seniors be able to come early, doing the enhanced cleaning, making sure that you have masking policies in place. Those are all things that will protect high risk. Janet?
Claire, it's Julie. I'll just jump in on that as well. I'm not quite sure the angle of this question, but it may be in regards to if you have household members who are high risk and you're returning home, perhaps. So there are things that you can do to take additional precautions. I would suggest definitely the basics like hand hygiene when you go home. But even if you have been interacting and there's a chance that droplets could be on your clothes, in an abundance of cautions, it wouldn't be a bad idea to even just change out of your work clothes and launder them fairly quickly or store them where they're not going to contaminate other laundry. So.
Great, thank you. And yes, there was clarification that it was about people who you live with who are higher risk. So thank you, Julie.
I know that there's a few more questions in there, Claire. I'm going to ask you to get to those as well. But if there's other folks that are interested and want to unmute their microphone, by all means, please join the conversation with your question orally as well.
Okay. There's one about, do we have suggestions about wearing masks, non-medical or medical, if staff sit back to back with 3 feet or more between them? Janet?
I'm going to defer to Julie on that one simply because the follow-up question to that is around aerosol spread.
Yeah, so they're both good questions, and I mean, really the bottom line is that orientation definitely plays a big role. So, you know, sitting staff members back to back could certainly be one good precaution. But I think given, and I'm not sure of the setup of the workplace or how much interaction there is, but if physical distancing cannot be maintained, then the advice is to wear a non-medical mask. If you're not in a healthcare setting, I would not suggest a medical mask. Those really do need to be reserved for healthcare settings. So a non-medical mask for source protection would suffice. The thing that we do need to keep in mind about droplets is they actually are quite heavy. So they do tend to drop to surfaces or the ground fairly quickly. There's research happening about fans and that types of thing in controlled environments, but we're still learning a little bit more about that. But the current advice in any setting right now, fans running even, would be that 2-meter separation or wearing a non-medical mask for source protection.
Great. There's a question about in workplaces that are using plexiglass shields that are placed between the employee and the customer. Is it still recommended that both parties wear masks? And that's actually, I can refer you to the toolkit and the sample policy where we have the section on exemptions in the policy. It says a person who is an employee of a business and are exempt from, they don't have to wear masks if they are in an area that's not designated for public access or if they're behind a physical barrier like a plexiglass. Okay, and thank you, Sandra. There is a link here that she shared that the Peterborough Chamber has a list of local businesses offering PPE supplies. So we can post that and share that as well after. Sorry, I'm just scrolling through here. Okay, is there any research into cars versus walking as a mode of travel to stores and the risk of exposure? As cars are high touch areas, is it safer to walk versus curbside pickup?
Oh, that's a great question. It would, it's absolutely safer to be outdoors, but the car would be your personal setting. So if they're in their car and then they leave the car and that you have your sanitizer available at the entrance, they'll sanitize their hands, which should limit any contamination that they would have on their hands from the car. And then they put on the mask and enter your store, and the mask would be protecting any droplet. And this is, I think what we're speaking here is we're assuming if somebody was asymptomatic or pre-symptomatic and they didn't know. Because if you're symptomatic, you should be staying home. That's just the #1 rule. If you have any symptoms, COVID or not, at present time, you should be staying home and shouldn't be out shopping and you should be getting somebody to get your essentials. So this is for the healthy individual who potentially could be pre-symptomatic or asymptomatic. And so you're going to have the sanitizer available at the entrance of your establishment. They put on the mask and they would go in and do shopping. So whether it's the car travel or the travel walking, it wouldn't make a difference based on the control mechanism that you have at the entrance of your establishment. However, I just wanted to highlight that the outdoor environment is definitely a safer environment at present because of the ventilation.
Great. That kind of speaks into the next question. There was someone's wanting more clarification on why is indoor setting more dangerous for transmission versus outdoor setting when you can assume that the wind would carry the droplets further.
So it's Julie. I can chime in a little bit on this. There's a lot of research happening on this right now, and there's some evidence out there to suggest that 6 feet or the 2 meters may not be enough in some settings when there's high winds. But again, it is an area that is currently being investigated. But typically in outdoor settings, things aren't as congested, and you have the ability to physical distance even further than the recommendation. There's less of a risk of surfaces becoming contaminated as well, like indoor settings. So just a couple of those functional features of outdoor versus indoor.
And I believe it may not be in the reference list, but that's a great question. And so when we send out these slides, I'll include some reading on this topic.
Great. I don't see any more questions in the chat box.
Terrific. But if questions do come up, by all means, we are here to help. I know that Brian at the city is open to questions, as are staff at Peterborough Public Health. So if you do have any questions or percolate on something over the next few hours or few days, by all means, please reach out to whomever that would be best to answer that question. And if there aren't any other questions, perhaps what we'll do is we'll sign off for now. And again, thank you for all that you're doing to protect those that live, learn, and play in Peterborough City County and the 2 First Nations. It's really a long haul right now. It's a marathon, not a sprint, and hopefully all the things that we're doing right now will help us get to the finish line. So again, thank you everybody for joining us today. Have a great weekend, and we'll be in touch by the end of the day with all of the resources discussed today. Take care.
Thank you.